Vaccines are very important because they keep us healthy and safe from preventable diseases. So how vaccinations work is that we take a part of a germ, which could either be a virus or a bacteria, and we've come up with multiple different ways to do that. So they take a little piece of that bacteria or virus in a way that it's not able to give you the disease, and then they introduce it into your body through that vaccination, and then your body's immune system recognizes that and actually builds a defense to that. So it either will prevent the disease, or if you end up getting the disease, it will make it much less severe, where it could prevent you from being hospitalized versus just having some mild cold symptoms at home. Infants are often more susceptible to having more severe symptoms of a disease and are more likely to be hospitalized, as well as any person that has an immunocompromising condition like chemotherapy for cancer treatment, and anybody over the age of 65 is more vulnerable to having more severe illness. Things like diabetes can also make you at risk for having more severe disease. And making sure that they're up to date on their DTaP vaccine, which has diphtheria, acellular pertussis, and tetanus. That is an important one because we've been seeing rates of pertussis or whooping cough have increasingly gone up in our county, in Clearwater County, but also in surrounding areas. Making sure that the influenza vaccine, COVID-19 vaccine, those are our annual vaccinations. And then some people might also qualify for, like, say, an RSV vaccine, depending if they're in that vulnerable population group. And MMR, measles, mumps, rubella, varicella, which is chickenpox, and then hepatitis A, hepatitis B. There's lots of different ones that we want to make sure our children are up to date on, because when they're in that school setting, they're at more increased risk of contracting those types of illnesses. We have our typical childhood vaccination schedule. So we actually start our vaccinations right after birth with hepatitis B vaccination. And then at our children's well visits, which are scheduled at 2, 4, 6, 9, and 12 months and beyond that. And then we have a routine schedule that we follow for that to get them vaccinated. And then adults also will have a catch-up vaccination schedule if they didn't have those vaccinations done in childhood. And also making sure that they get a tetanus shot done every 10 years. Vaccines are really important for community health as well, because not only do they prevent you and your family from getting that specific disease, but there is a concept called herd immunity, that if enough people in the community are vaccinated, that it helps to protect the community at large too, and helps prevent outbreaks. Some of the barriers that people might face is misinformation. Social media often has a lot of facts out there that people might think are true, and as far as potential adverse effects, fear of the links of autism with vaccinations, which have been proven to not be true. The most credible way to find access to information about vaccinations is the CDC website, so that's the Center of Disease Control, cdc.gov. Also, websites that end in edu are very credible websites. So a lot of learning hospitals, mHealth Fairview, they have a good website as far as information on vaccinations. Any other .org websites or .gov. Be wary of any kind of .com or any kind of links that you see on social media to different articles, because those haven't always been fact-checked. In our community, there are some barriers as far as access to care. So being able to get to a clinic appointment, we do have public transportation services available, and that is in multiple counties. A great place to get vaccinated is at your local clinic. So that can actually be done without a doctor visit. You can just present at the front desk and say, I would like to get my child caught up on their vaccinations. So even if you're not on track with the ones that they were supposed to be given before, we can definitely develop a catch-up schedule for them. They can be done also at the local pharmacy, and then checking with your public health office, they are able to do some vaccinations as well.